Hi, this is Ralph Moss. So I just finished 2 weeks of radiation therapy, and it's been quite a ride. More consequential, I would say, than I expected it to be. But I don't mean to be discouraging. It's really not that bad. In fact, it's kind of strange because the radiation part of it itself is sort of a non-event. It's almost, I hate to say it, but a little bit pleasant in the way in that it's doesn't hurt you, and it's quite fascinating, how this invisible ray, this new form of light that Professor Röntgen described 125 years ago, can penetrate your body and do such, good and bad things to you at the same time. But it's also difficult in ways that I really wasn't prepared for. And I'll just go into that a little bit, and then I want to tell you about some strange, frightening, and then ultimately okay thing that happened to me this week. So as far as the treatment itself goes, as I said, it's a kind of a non-event. I haven't had any pain associated with the treatment, and it's almost dreamlike in a way. You lie down on a kind of a gurney, and the machine rotates around you. It reminds me of that old machine. I don't know if they still have this, but when I was a kid, we used to go to the Hayden Planetarium in New York, and they had this big contraption that kind of moved around and projected the stars onto the roof of the planetarium. So it's kind of a space age device like that. It's called Infinity, if anybody's interested. That's the brand name of this linear accelerator that they got me under. And each session lasts about 5 minutes, and everybody's wonderfully nice and seem very competent, capable. For a local place that I've driven past 100 times, never realizing that there were these space age devices inside. But that part of it is fine. The hard part actually has to do with what they ask you to do in preparation for the treatment, which is basically not to be too inelegant about this, but to empty your bowels and to fill your bladder simultaneously. So that's because by doing that, you give them a better view of everything, and it pushes certain organs away, like the bladder and other organs, away from the zone that they're going to be irradiating. And all of this was developed over a period of decades of observation and studies and so forth. So it's done all over the world now, but it's another way that they have of preventing unnecessary collateral damage to your normal tissue. But my feeling is that they can't do that entirely, and so your very vital internal organs in that area are still at some degree of risk. Although, again, I'm not experiencing any pain from it, but it disrupts that whole process of emptying and filling and balancing those two things is difficult. And the aftermath of it is that you then have to sort of reverse the process, if you will. Again, I don't want to get too graphic, but you have to sort of reverse that and, of course, empty the bladder and et cetera, et cetera. So it isn't as easy as that sounds. And maybe I'm making more of it than I should, but I'm finding it that part is rather stressful, and I'm getting into the rhythm of it. After all, I've got about 7 more weeks of this to still to go, so I better get into the rhythm of it. But in any case, I'm doing it, and now it's Friday. It's a feeling of some relief, and I've got a break now over the weekend, which I'm very much looking forward to. So that's been the struggle, and I'm going to be talking to the doctor again on Monday because I want to get more guidance in terms of diet. It's not that they're proposing some sort of anti-cancer diet. It's nothing like that. It's that certain foods make it more difficult to do what they're asking me to do. And the diet that they handed me, which was a kind of generic handout from some other cancer center, just doesn't make too much sense to me. There seem to be some contradictions in there about fiber, because they're telling me to take a low fiber diet, and yet on the other hand they seem to be advocating for certain forms of fiber. So that has to be cleared up. Luckily, I see the doctor, or I can see the doctor every week on Monday. He's really very nice, and I trust him and knowledgeable on most things. He's already told me that he's not very knowledgeable on diet, unfortunately, and the dietitian that I did speak to was very nice, very easy to deal with, and sympathetic. But I have special circumstances, aside from the fact that I believe in, the healing power of certain foods and diets. But being a person with type 2 diabetes that's been controlled for over 10 years with diet and exercise alone, you can imagine it's a little hard for me to get advice to eat white rice and soft cooked spaghetti and things like that. Just not part of my lifestyle for over a decade. So this will have to be worked out. The big scare this week was about something that happened when I went to the dentist. Now, of course, I tell them I'm having radiation therapy for prostate cancer. They should know that. And everything went well. My teeth are good. And I was being examined by the technician there, the hygienist. And then the junior dentist, I should say, came in to examine my mouth, which was pro forma. And the hygienist pointed out to her that there was some sort of abnormality on the roof of my mouth. And the junior doctor looked at it, and I swear she sort of jumped back. I mean, and just kind of didn't scream, but she did this kind of startled reaction and made some noise, which was scary. I don't normally look at the roof of my mouth, and I didn't know what she was talking about, and I don't have any pain in that area. And then she sort of poked around, and there was a little bit, she made me aware of the fact there was a little bit of pain when she pressed on that area. And we took a picture of it with a cell phone, and it kind of looked nasty. I mean, it was like red, and there was actually a little hard spot there. And I could see, if you could read somebody's mind, I mean, that she didn't say, oh, well, this could be like a metastasis of the prostate cancer, which in retrospect doesn't really compute how that would happen. I mean, and I said to her, well, there's really no sign of any metastasis, and besides prostate cancer, when it metastasizes, you usually have a lot of advance notice of that. In other words, it breaks out of the capsule of the prostate and gets usually into the bones, and it's a whole big rigmarole. But I don't have any sign of any of that. Never have had any sign of that for 9 or 10 years now. So it left me, though. I mean, my rational brain was telling me, no, there's no way that this could be something related to the prostate cancer, but the emotional part of the brain, reacted to her reaction and left me with this kind of creepy feeling that maybe something bad was going on. By coincidence or by accident, I mean, the next day was the day that I was going to see the oncologist. So they scheduled me to come back and see the senior dentist. But they also gave me a referral to an oral surgeon or a more specialized dentist in the area. But next day I went to see my rad-onc, my radiation oncologist, and told him the whole story. And he examined it and didn't feel that he is an expert, of course, in all aspects of cancer, but he hadn't probably seen this before, or he was still a little bit concerned. He sent me to a head and neck surgeon in the next town over, And I think it was like the next day or 2 days later, I got an appointment because it was a classmate of his or something. But anyway, they're colleagues. And so I got in to see her. And she was wonderful. I mean, really wonderful. She had a great attitude. Her credentials are super good. She's a Yale graduate, undergraduate, and also did all her medical training at University of Chicago. So she has a top-notch background. And she had great attitude, very, very personable, easy to talk to, and interested in me and in her patients and so forth. So that was experientially, that was a really good experience. And I just heard from her about half an hour ago that I think she took a biopsy and it's benign. So it's some sort of ulceration, little ulcer. Ulcer sounds terrible, but if you think of stomach ulcers, but this is just sort of almost like a little sore in the mouth. And I think I know how I got it. I think this was a self-inflicted wound. I have a Waterpik, which is a great device, by the way, for keeping your teeth clean. And at one point, stupidly, I was kind of pushing the envelope and seeing how high I could go in terms of the strength of the stream of the Waterpik. And at some point, it sort of got out of hand, and I think the stream of the water hit the top of the roof of my mouth and kind of, broke the skin or something. And this was set up a healing reaction, which is taking some time to heal. I told her this story, and she thinks that this is most likely what happened. But I had 2 days there of suspense, and when you have cancer, and I'm sure many of you will relate to this, that in the eyes of maybe yourself, but certainly in the eyes of the world, it's like they don't know. And everything is related to the cancer. And the C word is so scary still in our subconscious and sometimes our conscious minds that you start to imagine, well, what if? And what if this is, somehow, as I said jokingly said to the head and neck surgeon, I said, at the very least, you could get a paper out of this if it turns out to be a metastasis from prostate to top of the mouth. But luckily for me and for her, that's not the case. So it turned out to be completely incidental, an incidental oma. Sometimes they call these kind of things. But I had my scary moment there, and but everything is fine. But this is the part of the psychological burden, I would say, of having cancer, is that you're left in a kind of a suspense. Everything now tends to get interpreted in terms of the existence of that cancer, and most times it's going to be nothing. And I hope that if you ever have that experience, you'll remember this and remember that overwhelmingly things are not extensions of the cancer. They're, that pain in your back or something is just a backache. It's not a metastasis, and those are the rare instances. But it could be, of course, but most times not. And I think that, luckily my knowledge was sufficient. Also, the another interesting thing was that the radiation oncologist, the rad-onc, whom I mentioned before, he took a look at the PET CT scan that I had at NYU Langone about 6 months ago. And that would not in any way be definitive, but there was no lighting up of the PET scan in that area. They actually the scanning, the CT scanning went up high enough that they actually included that part of my mouth in the scan. And there was no indication at that time of there being cancer there. As I say, that even he admitted and said that that's not definitive. But it was a reassuring thing. And as it turned out, there was nothing there. So on we go, on to week 3. Can't say I'm looking forward to it, but I'm looking forward to being done with it. In any case, hope you all stay well. This is Ralph Moss.